Thank you, Stacia. Well, more than 2,000 babies in the U.S. are born with the most severe form of congenital heart disease, and most of them start the first few months of their lives in the hospital. So in today's Medical Minute, we're looking at how new technology is letting parents take their babies home with the assurance doctors are keeping a close eye on them. Little D'Angelo Jr. has smiled through a lot this past year.
This is the scar where they cut him open to do the heart surgery.
He was born with a complex form of hypoplastic right heart syndrome.
Parts of his heart didn't form, so like we have chambers that open and close to let blood flow in. His was like born like a wall.
After 118 days and one heart surgery, D'Angelo was sent home to wait for his next operation.
We are very focused on watching them closely at home, but we like for them to get home. That's the best place for them to be if we can do it safely.
New digital home monitoring technology called Hearts at Home is helping doctors keep an eye on D'Angelo from a distance.
And the oxygen levels started to drop, kind of indicating that he needed to come back in.
Oxygen levels, heart rates, and weight can be monitored in real time through an app every single day.
There's also a place for them to put photographs, videos, additional information in terms of how the babies are feeding and pooping and peeing and if they're throwing up or not.
We are constantly on the iPad, on the desktop, and viewing where these families are at. We're on the phone, and we're catching things early for these families to make sure that nothing is happening at home.
Something did happen to D'Angelo. He caught COVID, but even then, he was able to stay at home.
It allowed us to watch him from afar and not have to admit him to the hospital.
He's strong. He's strong. He fights off a lot.
And since this app started back in 2017, the Rainbow Babies and Children's Hospital out in Cleveland says it has not had any infant deaths. And before the app, they said that number was as high as 15% nationwide.